The antibody infusion treatment is called Bamlanivimab, and essentially it's a monoclonal antibody that targets these little spikes on the coronavirus that are the proteins. It's something that Jerry Hardin says he didn't have to think twice about.
I never questioned. I said, yeah, I'd be more than glad to do it because, I didn't know how bad it was going to get.
Hardin is no stranger to surviving illnesses. He's battled cancer, and in December of last year, it was COVID.
And then I was extremely wore out. I had no energy whatsoever.
A week into the virus, his doctor called about an experimental treatment with emergency use authorization from the FDA.
Being what I've been through, I'll take that chance. And it was well worth it.
The entire process took about 3 hours at U of L in Shelbyville. The infusion takes 1 hour.
At least so far, it's working because we're not seeing those people being hospitalized.
Dr. Val Briones-Pryor says this treatment is for outpatient care and given to those first diagnosed with COVID.
If you give it early enough, we could prevent progression of symptoms and we can prevent hospitalization.
U of L does have criteria for who qualifies. For instance, you have to either be 65 and over, 55 and over with comorbidities, a BMI over 35, diabetic, have cardiovascular disease, or be immunosuppressed. From there, all you need to do is ask your primary care provider.
Within 48 hours. So that is how quickly we can get this infusion to folks.
Dr. Val says even if you don't think you qualify, it's worth asking your doctor about it. It's a treatment Hardin says he's telling all of his neighbors about should they find themselves with a positive test.
For the most part, my body feels like a new person.
As a reminder, this is an experimental outpatient treatment. There are different treatments if you're hospitalized. If you are interested in asking your doctor, they'll know what you mean if you call it the BAM antibody treatment. I'm Kristen Goodwillie, WHAS 11 News.